Members of the medical community say Everett is a hotspot for meth addiction in the nation, an everyday problem in the ER there.
They are hopeful about a new treatment that's being studied there that could produce a type of antidote that could fight addiction. Fox 13's Jennifer Dowling spoke with an ER doctor at Providence who's helping facilitate this study, hoping that it could finally help people who are fighting meth addiction.
It is. The study is part of an effort to get the treatment approved by the FDA. It's still in the early stages, but so far it's been shown to eliminate the high for those on meth, giving them the chance to complete treatment and other programs in order to get their lives together.
The ER at Providence serves as a type of safety net for the community, a place where doctors like Tom Roby regularly encounter people struggling with addiction.
There's not a day in the emergency department where we're not treating somebody on methamphetamine.
At Providence, he's helping to facilitate a study on a new treatment for meth addiction. Doctors are recruiting 40 people nationally, including several from the Everett area, as part of a national effort to get the drug approved by the FDA.
The sponsors identified hotspots around the country where methamphetamine use is particularly challenging, and Everett is one of those places.
Dr. Roby says the treatment works by using monoclonal antibodies, which have already been tapped for a range of medical purposes, including the treatment of COVID.
It's like the COVID antibodies you've heard about that bind the COVID molecule and COVID virus, and or bind the spike protein on the COVID virus and dismantle it.
The antibody is very specific for any type of amphetamine. Here's what it looks like in action, with the nerve endings in your brain represented in blue. The antibody shown here as a Y in the graphic.
So once it's injected into the blood, it circulates and binds that amphetamine so tightly that it pulls it away from the brain and moves it to the other organs that can help clear it out of the system.
Translation, the meth gets flushed out of your body naturally, but after that,
so it keeps the patient from getting high.
Once the antibodies are in the blood, given through an IV line, it remains in the bloodstream for almost a month and essentially pulls meth to it like a magnet and binds it.
It doesn't take away all of the effects of the meth, but what it does is it helps stabilize your thinking. It helps stabilize your life such that you can maybe go out and get your ID. Maybe you can get your housing voucher.
So far, Dr. Roby says in the early stages of the study, the medication has been almost as effective as some of the antipsychotic medicines that are used to treat psychosis and hallucinations, paranoia, and anxiety. Roby says he was skeptical about the treatments at first because there isn't anything out there to treat meth currently. But after seeing the positive impacts on his study participants, he changed his mind.
In many cases, within 30 minutes or an hour of them coming in, receiving the treatment, they'll be resting, maybe even napping. That's how calm people get after receiving this drug.
Dr. Roby also hopes that Everett can lead the way in providing groundbreaking treatments like this to folks that might not have access to it otherwise.
What has kept me really excited about this project is that the patients who receive this agent are coming back telling me that their lives are changed. They've gotten housing, they've got a job, they've reconnected with family members. These are the things that make it a joy.
And Dr. Roby says Sacred Heart in Spokane is also part of the study. He says it could take 4 to 6 years for this treatment to get approval for wide-scale use. He's hopeful that it one day will be part of a comprehensive approach to tackling meth addiction. Back to you.